Jessica Israel to help us learn more about Alzheimer's disease. Dr. Israel is here courtesy of our friends at Novartis Pharmaceuticals Corporation. Welcome to the show, Dr. Israel.
Thanks.
What exactly is Alzheimer's disease?
Alzheimer's disease is a progressive neurodegenerative disease of the brain. But what that really means in real life is it's a disease that takes a person's memory and it affects eventually every aspect of their life.
How easy is it to diagnose, and how important is it that it is diagnosed now?
A diagnosis of Alzheimer's disease is critically important. The earlier you can do it, the more you're able to affect that patient's life positively, right? It's a fairly easy disease to diagnose in the office. When a patient comes in, we use validated memory tests to see where they are on a scale relative to their level of education and their background, and then sometimes lab tests and sometimes some neuroimaging studies to put together the story. That being said, the medical tools we have in the office are no substitute for just a really good medical history and listening to what the people who have brought this patient in have to say about what's happening every day.
And so give us a little more about this evaluation process. What does it entail?
So it's memory screens really in the office, and we ask the patient a series of questions, some easy and some are a little bit difficult, and then we sort of put together a score that tells us where that patient probably is memory-wise, helps us make a diagnosis. But again, it's hearing what's happening in that person's everyday life that puts together the real clinical picture. Alzheimer's disease is a clinical diagnosis. Your lab tests, your brain imaging studies, and your testing really just backs up the story that comes into the room.
Do we have any idea as to what causes Alzheimer's disease?
It's an interesting question because there are a lot of theories. There are clear pathologic changes that happen when you look at the brain of someone with Alzheimer's disease. There are structures that form called plaques and tangles that clearly affect the functioning of brain cells, although it's hard to tell exactly how much, exactly how, and what chemicals are involved. Lots of theories, but no clear reason why.
And so what do we do, Dr. Israel, if we suspect our loved one does have Alzheimer's disease? What do we do in terms of finding the right care team and to diagnose it and also to treat their needs?
The most important thing that you can do if you think your loved one has Alzheimer's disease is bring them to the physician's office and then tell the story. Tell the physician why you think this and let the patient's voice be heard as well. That's the most important thing. That way the physician can put together a plan to treat the illness and also to support the needs. A lot of times when patients come into the office, the best question you can ask as a doctor is, tell me what's going on this week. Tell me what's been going on for the last month, because that way you can design the treatment plan that really meets the needs of that person.
I have to tell you, just excellent information for families who may be dealing with Alzheimer's right now or may even suspect their loved one has Alzheimer's disease. So thank you, Dr. Israel, for being with us this morning.
Thanks.
And for our viewers at home, there is so much information out there for you. And so